Hello, everyone. We're just going to give it another minute for everybody to trickle in, and then we'll get started. For those of you who have just joined us, hello again, and I'm just going to give it another minute, and then we'll get started soon. All right, we should be all good to go. So hello, everyone, and thank you for being here. We are very excited to be kicking off the 2024 SIIM Hackathon. Today is the orientation session. So this is the session where I'm going to help you find your way, set expectations for what the hackathon looks like, timelines, etc., so on and so forth. The format for this webinar is very informal, so please feel free to ask your questions at any time you have, and I'll do my best to keep an eye on the chat. You can either throw it into the chat or you could use the Q&A feature. Whatever works best, feel free to use it. In my presentation, I'm also going to be covering some links, and I'll make sure that I copy and paste those links into the chat so you have them available. Last but not least, I do remind you that this webinar is going to be recorded. Once it's finished, we're going to post this webinar online, and it will be available for you to watch again or share it with your colleagues as needed. So without further ado, I want to just point out one thing before I move on with my slide deck. One of the cool things about the hackathon is the fact we've been running for so long that we can use our own photography. So the picture you see here, in case the SIIM hacks here wasn't a giveaway, is a picture from a real SIIM hackathon. This is not stock photography. So very proud of that fact. Now, that being said, some of you may be new to SIIM, and in case you've not had any interaction with SIIM or not attended one of the SIIM annual meetings, why is SIIM hosting the SIIM Hackathon, and what makes SIIM special? Firstly, SIIM has a reputation of everybody around being extremely warm, approachable, and welcoming, and that's something you're going to see if you end up coming to SIIM in person this year. SIIM is also very generous with memberships that are free for students. It's actually any member in training. So if you're a student, whether you're undergrad or you're an MD in training, etc., or you're somebody doing your PhD, you get a free membership, and you also get a free pass into the annual meeting. That's really, really cool. And of course, you're highly encouraged to take advantage of that. SIIM is also built around both education and networking for a meaningful career and a common purpose. So we usually say that people at SIIM get it. People are there for the right reasons because they see the value that imaging informatics brings into the whole healthcare and how that contributes to a better outcomes for patients. And of course, with networking comes the focus on collaboration and advancement of patient care. Now, the SIIM Hackathon itself is a reflection of SIIM's values. So, as you can imagine, it's trying to be as accommodating as possible. So firstly, the hackathon is hybrid, meaning that you can participate fully remotely if you wanted to. But if you are attending SIIM 2024, then you also have the option to do things on site. There will be physical activities that are completely optional. The hackathon is 100% free for everyone. It doesn't matter if you're a student or not. Even if you don't qualify for the SIIM free membership, you can still participate in the hackathon for free. The other thing about the hackathon is, keep in mind, our cloud platform is actually available all year round. So there's a hackathon event, which is happening soon, but the platform is available all year round because it's mostly an educational purpose rather than just the hackathon itself. The hackathon, in our case, is also non-competitive. This is not a hackathon where everybody is going crazy, staying up late nights and drinking, energy drinks and trying their best to win the hackathon. In this case, of course, you're encouraged to try and win the hackathon, but that's not the reason we're all there. And one of the things we've done to show this is that we don't actually give out cash prizes. Winning is purely sentimental. This hackathon is all about education. We're hoping that you're going to come and learn some practical skills in a fun, hands-on type of way, right? Maybe you're somebody who's new to the domain and you're curious about this DICOM and FHIR stuff that we imaging informatics people talk about. This could be an opportunity to actually learn by doing. Or maybe you're somebody who's been in the field for a while and you keep hearing about this new FHIR thing that sounds really cool, but you've not had a chance to try it. Again, this would be our opportunity to try it. The hackathon is also built around collaboration, just like SIIM. So we want you to mingle with people, as many people as you can. Talk to people from other walks of life, and understand how they view the world, their problems, how you could fit into the picture and help with things. And of course, all of that comes with a healthy dose of networking. So here again, we want you to socialize with people that make up the different personas of SIIM. So maybe you're a developer by trade. This could be your chance to hang out with some people who are clinicians or technologists. Vice versa, maybe you're a radiology resident and you've never talked to a developer before. This would be your chance to get an idea of what that looks like. So again, this is what the hackathon is all built around. It's non-competitive. It's not about winning. It's more about having fun, learning something, doing something really cool. Now, a common question we get is, aren't hackathons for coders, people who develop, software developers? And the answer is definitely not. Over the years, and in a moment, I'm going to tell you how many years, we've had people come from all walks of life. We've had clinicians, again, people like radiology residents in training, radiology fellows, etc. We've had technologists. We've had people from so many different walks of life, PAX admins, you name it. It's not just developers. Of course, we've had developers, but we've had other people too. We also help with matchmaking. So for example, we may get somebody who is a clinician, has a cool idea for an app that solves a real life problem they have, but they don't have the technical skills to build a solution for it. On the flip side, we get somebody who's a developer who's like, hey, this hackathon sounds really cool, but I don't know what to do. We can find the two and help them find each other. There are multiple ways we do this, and I'll get into some of these details later, but that's one of the things that we do. We also have a roster of mentors that come from different backgrounds, and these people can answer pretty much any question. Now, I'm joking here about what's the meaning of life. You could try to ask them, but that wouldn't be the optimal question to ask. But these people come from such diverse backgrounds. So whether it's a question about code, system architecture, or radiology workflow, or hey, is this even a real problem in real life? These people can help you with so much. So we are very, very proud to have celebrated the 10th hackathon last year. So this year is actually the 11th hackathon. This is a picture from the very first hackathon back at SIIM 2014. And we're very grateful to the people you see here in the picture for all the hard work they did in getting the hackathon up and running. So we are very, very proud of the impact the hackathon has had on the general industry, the imaging informatics industry over the years. And of course, keep in mind, the imaging informatics industry is not a big one, but obviously a very influential one, because without imaging, healthcare doesn't really function the same. So in 10 years of hackathons, we've had 200 plus committee meetings. And we point that out because that SIIM Hackathon committee is one of the committees that meets most often of all SIIM committees. It's not the most often, but one of the more often ones. So there's a lot of volunteer hard work that goes in putting on the hackathon that you see in place. We've had 101 individual winners since 2020, and 172 projects presented since 2014. Now, the number of winners is higher than the number of projects because in many cases, the winners are teams. So it could be a team of 4, a team of 5, etc. To access the hackathon platform, you need an API key, and we've issued 661. It's actually increased since then, since 2017. The hackathon essentially gave birth to 12, or at least 12, open source GitHub repositories. And over the years, we've had the pleasure of having 49 esteemed judges. And you'll see in a moment, we curate our judges to be people who don't just judge what you did, but give you useful feedback. So in a way, they're almost like mentors on their own. Over the years, we've got a number of projects presented, and as you can see, the numbers are generally trending up. Everything right now is pointing in this year being as good as last year, maybe even better. We've also contributed to the SIIM ecosystem with webinars, podcast episodes, journal papers, and so on and so forth. And here's a breakdown of the number of people we've had over the years. So here you can see, for example, that although developers are a chunk of what we get, there's actually pretty much everybody else represented. So again, it's a very diverse hackathon. It's not your typical run-of-the-mill hackathon. In case you're wondering, what is the hackathon bringing to the table? Essentially, it's the three things you see in these three boxes. So we have a bunch of servers and a bunch of APIs that you can play with. We have a data set, and we have an awesome community. So the servers in this case run the gamut of modern standards. So in this case, it's FHIR R5 as of this year, plus R4 for backwards compatibility. We have DICOMweb, HIR, and again, the server is running 24/7 in the cloud, and it does require an API key to use, but that API key is completely free to get. The SIIM dataset is one of the things that we've very meticulously worked on over the years. And it's a really cool data set. So basically it has 10 patient personas. So it's not the biggest data set. It's not a data set you're going to use to train an AI model. However, what's cool about this data set is it has lifelike data. So it's realistic without being real. It's made up from multiple exams, but in a way that makes clinical sense. And in this case, the other cool thing it does, it also brings clinical FHIR type data with DICOM images. So it represents a fully comprehensive patient record, which is really the ultimate use case for healthcare. Now, I should point out that our servers can accept your own data. So you have the option to upload, whether it's FHIR or DICOM. They do reset nightly, so just watch out for that. So if you upload something today and it's not there tomorrow, it's because the nightly reset removed it. Oh, and I apologize. I also forgot to point out that the DICOM data we have in the SIIM Hackathon dataset comes from multiple specialties. So of course, radiology is the biggest one represented, but we have things like pathology, dermatology, ophthalmology, etc. The list goes on. The community is also something we're very proud of. We have all these 5-minute start guides. So a start guide for something like FHIR that in 5 minutes gets you from knowing almost nothing about FHIR to having basic understanding of what FHIR is like, how it actually works in real life. And of course, we have more documentation about more niche type of use cases. And we keep adding more and more year after year. We, of course, provide mentorship, as I mentioned before. We have a long list of mentors. And of course, we are a community. So we have live chat via Slack, and we do Zoom sessions where we exchange ideas and talk about things openly. It's going to be a very interesting experience. Now, this is an old slide, but I still like to use it. It's actually very, very old. This is back when the data set was just literally 5 patients. So as you can see, we are now at 10. But the idea is really simple. So for each one of the patients, you've got a bunch of DICOM studies and then a bunch of FHIR resources. So this is what I was trying to describe before, where I said we are marrying clinical FHIR data with imaging data. That's basically what it looks like under the hood. And I do see that we've had a number of people join us since I started. So just a reminder for everybody, glad to have you here with us. You're welcome to ask questions at any point. I've got the chat window open and the Q&A window open. Feel free to throw in your questions at any point. And in a moment, actually, starting with this slide, I'm going to be sharing some links. So I'll also be putting those into the chat for your benefit. Last but not least, this webinar will be recorded, will be available publicly, and the link will be posted on the SIIM Hackathon Slack channel. Okay, so every year, the committee works very hard on bringing something new to the hackathon, keep it fresh, keep it interesting. So this year, we're proud to have a dataset growth. We've added more studies. So this year, we've actually integrated pathology studies into the dataset, into the SIIM personas as well. This year, we've gone to FHIR R5, the latest and greatest. But we've also kept R4. So we have 2 FHIR endpoints. One speaks the latest and greatest, and one speaks R4 because R4 is what most of the EMRs are still using. Last year, we brought in LLMs, large language models, and that was very, very popular. So this year, we're bringing even more. And then we've also grown our documentation this year with a number of cool new articles that I'll cover. There's actually more stuff in 2024, but I'm just keeping to the biggest highlights. Now, a number of things that were new last year, which we've kept, is the fact that the hackathon is hybrid. So that's what you've seen. Again, it's a hackathon that you could fully attend remotely. But if you happen to be coming to the SIIM annual meeting, then there will also be things you could do in person. It is also an extended format. So the hackathon is going to be 9 days long. And the reason why we did it that way is because we've designed the hackathon so somebody who is a full-time student or working full-time can still be able to participate in the hackathon without feeling too much pressure. So generally speaking, if you've got an hour or so a day to spare, you should be able to participate in this hackathon. There's one more reason, well, I'll point out later, why this is even more true. But do remember that I did say this hackathon was non-competitive. That's a big part of it too. Last year, we made some initiatives as far as idea and team curation. So we asked people to pitch their ideas into a Google form and then try and form teams in advance. All that stuff has been carried over to this year. Last year, we experimented with the concept of a social media badge, which we, again, have this year. That was pretty cool. Just, posting on LinkedIn saying, hey, I'm participating in the SIIM hackathon. Just bring awareness to this. And I will provide the link to that in just a moment. And then, of course, we have been giving out e-badges for people to proudly show off on their LinkedIn profiles. That's also being kept for this year as well. We post our documentation on this website right here. I'm also going to throw the link in the chat. So this documentation is your gateway to pretty much everything hackathon related. So there's information about the server, information about the actual hackathon event, how you can get on our Slack, how to use Slack, how to use DICOMweb, how to use FHIR, etc. It's very rich. It's probably one of the things that you want to have handy when you are participating in the SIIM hackathon. So I mentioned this year is a hybrid and extended format, like it was last year. So this is a general idea of what it looks like. So in a few weeks, on Thursday, June 20th, we're going to be doing the brainstorming session. It's a 2-hour-long session. And this session actually serves as a number of things. So it's the unofficial kickoff of the hackathon. It's also a session where we get on and we basically get to geek out about all kind of cool things that could be done in medical imaging, whether it's problems, room for improvement, etc. And that, of course, includes a list of ideas that's been submitted in advance to the project list. And this is also the chance for matchmaking. So, for example, I could be on that call and I'm interested in joining the SIIM hackathon, but I don't really know anybody. But then I hear somebody talk about their cool idea and I'm like, oh, that sounds really cool. That's my chance to contact them, say, hey, any chance you're looking for a teammate? I'd love to join. That's one of your chances for that matchmaking that we mentioned. So after this call, as I mentioned, that's the unofficial beginning to the hackathon. Now that brainstorming session is Zoom-based. And then after that, we go to Slack. Once we are on Slack, we do have a check-in meeting every day at 12 p.m. Eastern. And these check-in meetings are just designed that if anybody is stuck, they can get on this call and somebody could try and help them get unstuck. If any of you are familiar with development methodology, a stand-up meeting, this is basically a stand-up meeting. On Saturday, June 29th, so 9 days later, the hackathon basically stops, where we now go into the showcase. And in this case, our participants will be showcasing their projects, and then both the judges and the audience will pick a winner. So we actually have 2 awards. There are the number 1, 2, 3 picked by the judges, and then there's 1 award for the audience choice. And remember, as I mentioned, the hackathon is fully hybrid again this year. So that means whether you're in person or remote, you're going to be able to participate at the project showcase, you'll be able to present. So we actually have a Zoom link. So even if you're remote, you're able to present to everybody sitting in the room, and they're still able to interact with you and ask you questions and so on and so forth. So I mentioned this when I was looking at the timeline, but just to confirm, we basically have the 2 sessions that are taking place on Zoom, the brainstorming and the project showcase. And the project showcase is on Zoom if you're remote. But if you're going to be at SIIM in person, then that is actually going to take place in a physical location where you can come and attend and watch it. But then everything else we're going to be doing on Slack. If you are interested in the SIIM Hackathon and have not gotten on Slack, I ask you to please do so as soon as possible. And I just dropped the link in the chat. It's that bit.ly link. Slack is our main vessel of communication. And if you've not used Slack before, it's actually a really nice tool that lends itself really well to this. I'm actually going to show you very quickly just what it looks like, just so you are aware. So here is our Slack space. And what you'll notice is you can, of course, post messages and reply to people's messages and whatnot. So you have the concept of channels over here. And in here, you're going to find channels like code heroes and domain experts. So these are our mentors. I'll be pointing out that in more detail in just a moment. You can then also tag people. So you could use the @ symbol to tag people. And then from there, you get their attention. There's also tagging @channel, which pings everybody. Now, of course, that one, please use sparingly. I, in this case, kind of woke up the Slack space after a long hibernation. So the use of @channel was warranted. But again, in other cases, please be careful with that. So this is Slack. I dropped the link in the chat. And then if you're coming to SIIM, the annual meeting in person, we are going to be in the exhibit hall. So this is a general map of the exhibit hall. I don't actually know the area very well personally, but I believe these are the doors. So basically, if you're coming in, you'd be looking for that one corner right here. So in there, we're going to have tables available for you with power bars, etc. And that's the area where we're basically going to be hanging out most of the time. Now, remember, you're, of course, very highly encouraged to attend SIIM in person if you're able to. That being said, if you do, as much as I'd love for you to be hanging out at the hackathon space all day long, I highly encourage you to go check out sessions. So take breaks, go attend some sessions, learn a few nice things, make connections with people outside the hackathon, because I also want you to make sure that you get the most out of your SIIM experience. There are a couple of on-site social events. So if you're going to be there in person, a couple of things that we encourage you to attend. The first one is called Code Freeze, which is basically what we, the nifty name that we came up for our ice cream social. So Code Freeze is just an event where somebody's going to come in with an ice cream cart, and we're going to be giving out ice creams and just enjoying ice creams and hanging out. So that's going to take place Friday, June 28th, between 12:30 and 1 p.m. It's going to be at the hackathon headquarters. So that's that area I just showed you in the exhibit hall. That's what we call the hackathon headquarters. It's completely free to join. You don't need to RSVP. Just be there at that time. And that's basically it. SIIM also has a general social networking event, which is the welcome reception. So this is for everybody attending the SIIM conference. That actually takes place the day before. It's in the Sunset Room, which is still in the same Gaylord Resort. So it's all walking distance. This one here does cost money. It's $25, and you can either buy your ticket when you register for SIIM, but I believe you also have the option of buying those tickets at the door as well. So again, encourage you to attend this one if possible, just because this is your opportunity to also mingle with people outside the hackathon. It's always a very rewarding experience when you get to meet people that you don't typically get to talk to. So highly encourage you to do this. Now, I mentioned that to use the hackathon servers, you have to have an API key. Reminder, those API keys are completely free. You don't need to be a SIIM member. Anybody can get an API key for free. However, to do this, what you need is you need to get a SIIM.org account. So you go on SIIM.org, you sign up for an account, completely free. You don't have to get a membership. And then once you do that, you would then sign the agreement, and I'm going to drop the link in the chat. So the agreement just says, hey, I'm not going to be doing anything malicious on your servers. I'm not planning to upload any PHI, et cetera, all that stuff. Once you sign this, you'll be hearing from me where I'm going to email you with an API key that you can then use the server. Now, do remember those API keys are for you and you alone. The license terms stipulate that it's basically one license key per person. If you have a friend or a teammate or whatever, they should be getting their own keys. Again, completely free to do so. It just requires that the two steps: sign up for an account and then request the key. Now, the keys are issued manually. So I usually tell people expect one within 48 hours. I usually get to them much sooner, but if you catch me right before the weekend, it may just take a little longer. And of course, don't forget to check spam. These days, I feel like email has just become such an unreliable method of communication. If you don't get your key in time, feel free to get in touch and I'll help you out. Oops. Now, once you have a key, you will need your key to make any API requests. So whether you're talking to the FHIR endpoint or the DICOMweb endpoint, you always have to have your API key in your request. And what you want to do is you want to set it up in as HTTP header. It's literally the word API key, all lowercase, and then your API key. Whether you're using curl, Postman, Insomnia, you're writing code, whatever it is you're doing, that's what you want to do. Now, if you're a GUI type of person and like to use a user interface rather than just APIs, you can use something called mod header, which is a Chrome extension, so you could use the GUI. Because in the case of our server, both the implementations we have for FHIR and for DICOMweb have a GUI that you can actually use. It may be a little bit easier to be able to see things and do stuff, and I'll show you that in just a moment. So if you were to do this mod header Chrome extension, this is a general idea of how you'd set it up. Now, this screenshot is a little outdated. I apologize. It may not look exactly like this anymore, but the principle in general is the same. Basically, what you're telling it is, when I hit a URL that matches this pattern, I want you to send this extra HTTP header with this value. Now, this value is a generic key we use for this particular session today. That's why it's called Hackathon Orientation Session. As you can imagine, this is going to work for today, but it'll be deactivated later. So at some point or another, you'll want to replace this with your own key once you've gotten your own key, if you haven't done so already. So to use our API, you would basically just make requests to the following endpoints. So hackathon.sim.org/FHIR for FHIR, /DICOMweb for DICOMweb, and /Sol for IHE-Sol if you wanted to. Ghulam, I do see your raised hand, but I don't think I'd be able to unmute you because it is a webinar. Would you like to maybe just type your question into the Q&A? I'm happy to answer it. All right, and while you type, I'll cover this part. So again, whenever you're hitting any of these APIs, you got to make sure you include that API key header in your HTTP request. And you could use HTTP or HTTPS, both are perfectly valid. And of course, this is going to work over any HTTP method. These are fully RESTful APIs, so get, post, put, etc. All that stuff works. All right, and we are now indeed at the time where I'm going to do a demo. So in this case, I am going to use Postman. However, as I said, this would work with anything else, whether you're writing code in Python or you're using a command line application like curl, or even using Insomnia. It should be a very, very similar experience. So I'm going to go ahead and switch to Postman. And in this case, I'm going to start with a simple example where we're going to hit up, let's say, FHIR. So I'm going to say https hackathon.sim.org/FHIR/patient. I'm going to search by family name equals SIM. Okay. So I'm not trying to teach you FHIR here. I'm just trying to show you that it works. And you may have noticed that it shows up in my history, but I still chose to type it just so you fully believe me that it actually works. And here I'm going to go into the headers. I'm going to add my API key and hackathon orientation session. And that should be all I need to do. At this point, I should be able to fire off this request, which is what I'm going to do. And as you can see, it came back with a resource bundle that has 9 matches. So it found 9 patients that match mine. One of the things I want to show you that's really cool if you're a beginner when it comes to coding and APIs, one cool thing about Postman is if you look at this thing right here, it says code. There's an option in Postman to export whatever API call you get into code. So in this case, this right here gives me Python code that I can copy and paste and plug into my application or prototype, and voila, it's working. This feature is also useful because if, for example, you want to try this in command line environment, say you're a Mac user or a Linux user, that's the command right here. And as you can see, the list goes on really long. If you're a C# person, you could do this in C#. If you're a Java person, you could do this, JavaScript, etc. All these options are available. So that makes it really, really easy for you to be able to get something working here using a GUI, figure out all the nitty-gritty details, and then take this over to code. Now, the example I showed you is not very sophisticated. It's a very simple API call, but occasionally as you get deeper into FHIR or whatnot, it takes some tweaking, how you send, say, for example, you're creating a FHIR resource, how you send it as a request body, how you set your content types exactly right, so on and so forth. So that's where you can come and tweak all of this stuff here and then just make it work, copy paste the code, and you're all good to go. Now, I promised a couple of demos, so I'm going to go ahead and switch to DICOMweb. In this case, I'm going to say DICOMweb/studies, and I'm going to filter for patient name equals SIIM star. So in this case, I am asking the server for anything that has a patient name SIIM star. I go ahead and fire off that request, and right here, as you can see, it's come back with a bunch of studies. So in this case, this is patient SIIM Joe. If I scroll down, there's SIIM Sally, and so on and so forth. So this is a very, very basic introduction to how you use a tool like Postman, how you plug in your SIIM API key. Again, in this case, I'm using this generic key. In your case, you'd be using your own API key instead. Okay, I do want to show one more thing, as I mentioned, for people who like to use GUIs. So if you are a GUI type of person and you manage to get mod header working, which apparently haven't. Oh, I know why. HTTPS. So if you get mod header working, you'll be able to use GUI version for these servers that we use. So if you hit up hackathon.sim.org, this takes you to the homepage of the happy servers that we use. And here, as you can see, it actually shows you the counts. So we have 10 patients, we have 64 imaging studies, and so on and so forth. So that's basically a GUI here. For example, I could come into the patients, I can perform a search. In this case, I'll just do an open-ended search. This will come back right here. My bundle contains 10 entries, so that's 10 patients. I can click on any of these patients, so I could read the response right here. So again, having to do this because it helps you just troubleshoot something if you're a GUI person. I do see a note right here from Nick about being careful to use mod header on all websites. Yes, absolutely agree with that. So that's why in my example, I showed you how to do the URL pattern. It's very important that you use the URL pattern so that your API key is only sent to our server and it's not being sent to every single website you visit on the internet. Thank you, Nick. Very good notes. Now, I promise that there are two of these endpoints or GUIs here. So the other one is /VNA. And if I go to that one here, you see the GUI for Orthanc. So Orthanc is the DICOM server that we use under the hood. And again, similar experience here. I can click on all patients and I'll be browsing all these patients, so on and so forth. Or I could search for patients and then I can now view these patients. Let me just find a different study here. So let's go something like a CT chest. So now I can browse a different series within this study. I can then open up viewers and see the study in these viewers. So in this case, once I accept this, right here, I can scroll through, so on and so forth. So again, this is nice in case you need to troubleshoot something or you don't have your own viewer, etc. You have an option of just using what we have in place to make your life easier. Okay, so that was a quick demo here that showed you basic interactions with FHIR DICOMweb. Again, our documentation has a lot more information about that topic. So if you visit the documentation link that I put in the chat earlier, you'll be able to see more examples of how to do things. And then, of course, there's the GUI option as well. I mentioned that we have mentors, and we have two types of mentors. So we have code heroes. These are people who can help you with technical code type of problems, architecture, etc. You can find them in a Slack channel called Code Heroes. And then we have domain experts, who are people who are a lot more immersed in clinical workflows. Some of them may even be clinical themselves. So they can help you with a workflow question like, hey, how does a radiology workflow actually work in real life? Or They can help you validate a solution that you're imagining, hey, an LLM could be used to do this and that. Is this an actual real problem, or am I just imagining this? So those are our domain experts, and you can find them in #domain-experts. That's the Slack channel where they hang out. So the idea is really simple. You just go into one of these channels, you ask your question, and then they will help you with answering your questions. They'll be able to give you pointers and whatnot. By the way, I should point this out. For anybody here on the call who is a mentor, whether you're a code hero or a domain expert, being a mentor does not preclude you from participating in the hackathon. It is not a competitive hackathon, so you are 100% welcome to become part of teams and participate with guiding these teams to doing the right thing. Absolutely welcome to do so. I am not going to read this slide. You are welcome to try and read it if you want to, or take a screenshot. But we show this for transparency. Remember when I mentioned that it's a non-competitive hackathon? It's designed for people who are even working or studying full-time and just want to do something for fun on the side. We also like to keep the bar low for winning. So it's the winning in this case isn't so much about your effort as much as the fact that you had a cool idea and you made some effort towards it. So it's not how much effort, it's just the fact that you've tried to do something about it. So usually when I brief the judges, and I get the pleasure of doing so, I usually tell them, you could read this whole thing, but the long story short is we're looking for cool ideas. It doesn't matter if the prototype looks like wireframes or if the prototype blows up halfway through the showcase presentation. None of that matters. Just cool idea. They made an awesome effort towards it. That's all we're looking for. So that's also what we're looking for from you as well. Now, we do try and keep a lively presence on social media. And of course, we could ask for your help with this if you could help us, please. Use the hashtag SIIMHacks. Definitely appreciate it if you take a moment after this call and brag about you participating in the hackathon, whether you're a participant or a code hero or a domain expert or a judge. We do have a social media badge that you can use, partly because A, it makes your post look a lot cooler, and B, people are more likely to notice something with a graphic rather than just a text post. I just dropped the link in the chat, so that's where you can find that social media badge. Again, just whether you're posting on LinkedIn or Twitter or something else, if you could please use that badge, it would be appreciated. If you go on to win the hackathon, and remember there are essentially 4 prizes to be won: first place, second place, third place, and audience choice, then you would get one of these coveted badges that you can apply to your LinkedIn profile. And these are actual real e-badges with a URL that validates in the whole spiel. It's not just a piece of graphic that we give you to stick on your profile. In case you need inspiration, first thing you should look at this year's documentation. Look at the link that says what's new in 2024. Look at the list of projects that have been pitched. But if that's not enough inspiration, we have curated last year's and the year before's projects into YouTube lists. And I just posted those links in the chat. You're more than welcome to have a look at these in case it sparks any inspiration. Just the type of projects, the type of people that participate, so on and so forth. Okay. Should anything come up where you need to request help, please feel free to email me before the hackathon. Most people have my email for one reason or another because I issue the API keys, but in case you didn't, I just dropped it into the chat. If you're already on Slack, you're welcome to ping me on Slack. You could do a direct message, like a private chat, or you could just tag me and that will get my attention. During the hackathon, I will not be your first line of defense. I will be your last line of defense. So in this case, you can ask for help on the general channel, Code Heroes, Domain Expert channels. As you form teams, we usually give each team a channel. So your team can just let me know. I'll create a channel for you so you can hang out and talk to each other. Again, you can tag people to get their attention. So for example, tagging me with @Muhannad. You can essentially get people in bulk. So @channel means everybody in the channel will get notifications. @here, it's only the people who are online. So anybody who's offline, they're asleep or whatever, they will not get the notification. It's only people who are actually online. In general, there are a number of things that we encourage you to do, not required, but just very highly encouraged. So you're highly encouraged to consider open sourcing your work on GitHub, if at all possible. A friend of mine has taught me that if I'm ever writing code on my own time or my employer is not paying me for it, by default, I should be open sourcing that code, because why not? Now, I recognize this is not easy for everybody. Sometimes people are embarrassed about putting their stuff out there because, oh, what if people see it and people make fun of me because my code isn't great? I will tell you, my code is definitely not great, but I've been putting it out there for years, and I've had nothing but good interactions. I've gotten people saying, hey, this was actually useful. I took this and I was able to turn it into something useful. So highly encourage you to consider that. Make use of open source packages as much as you can, all the way from things like Cornerstone, OHAViewer, Happy, DCM4Chi, PyDICOM, the whole spiel. Open source enables you to do so much more with less investment. So definitely make use of that. And of course, mashups are always fun, whether you're bringing images from the TCIA or using terminology from Adlex or Loink. I'm not going to tell you what kind of ideas to work on, but when you do, consider bringing in extra things. It adds to the richness of it. And of course, we're in the age where ChatGPT is everybody's friend. So yeah, ask ChatGPT for help. This is absolutely totally cool. And do tell us how it goes. If you get a funny answer or you get a good answer, share with everybody else. That's always fun to see. Now, I would be remiss to have gone through this entire webinar and not thanked the army of people who make this a possibility. So I want to start with the SIIM Hackathon committee. There are volunteers who put in a lot of work and a lot of time all year round to make sure that the hackathon comes out better every single year and bigger. The SIIM staff have been relentless in their support over the years. We are a geeky bunch, and we're not very easy to put up with, but they've always done it and always come through for us. Our mentors, who have just been awesome year after year, can't thank you enough for the support you provide. You are one of the pillars of our community. You're the face of the hackathon, and you're what makes it special. And of course, last but not least, our judges. They are thought leaders in the industry who are very, very busy, but still carve out a couple of hours to come and help us judge the hackathon and always give encouraging, meaningful feedback to the participants. And they have them walk away from the podium feeling even more empowered than when they came in. And with that being said, I, of course, encourage you to engage with us all over social media. There are the general tags for SIIM on Twitter. And of course, on LinkedIn, you could use the same. Remember that the hashtag for the hackathon is SIIMHacks. And at this point, I thank you for your attention and patience with me as I walked you through all these things. And I am happy to take any questions. So if you have questions, please feel free to put them into the chat window or the Q&A feature, whichever one is easier, and I'll be happy to answer them. And Ghulam, I know at some point you had a question. I don't know if it still stands or not. I don't think I saw it in the chat. Apologies that I can't unmute people. It's a webinar. I see a number of messages in the chat. Thank you, everybody. I appreciate you being here. If you don't have questions, you're welcome to go. I'll stay here for another minute or two just in case people have questions. But otherwise, thank you again for your time, and I will talk to you in a couple of weeks when we kick off the hackathon.